expert on scabies. Gosh, I'm starting to itch just thinking about it. Scabies is a little tiny bug that burrows under your skin and bites you. Makes you itch like crazy. In fact, that's kind of one of the main ways that I diagnose scabies is, does the itch keep you awake at night? In women, even your nipples start itching. It drives you crazy and you can't stop. You can try taking Benadryl. It might help you sleep a little bit. Scabies kind of makes this rash that shows up in your armpits and where your elbow bends and in between your fingers and the backside of your wrist. Sometimes it gets in your armpits and behind your knees and in between your toes, even in your groin. So the scratching leaves marks. You know, you might be scratching between your fingers and you get little scrape marks or spots. And sometimes you can actually see the little burrows that the scabies leave. So that's how we kind of make the diagnosis. It's really hard to catch one of those little boogers and look at it under a microscope. And my patients can't afford to go to a dermatologist and get a biopsy or more fancy diagnostic tests. A lot of times we just base the diagnosis on the history and the physical examination. But whenever somebody is itching all night, scabies really comes to mind. I always think about other things that could cause itching. Allergic reactions. Did you just start using a new perfumey soap? But that rash really looks a little different, and a lot of times it doesn't itch as bad as scabies does. Hepatitis makes you itch. Liver failure, liver disease makes you itch and keeps you awake at night. So that's always in the differential diagnosis. Other things can make you itch, like blood disorders like polycythemia vera. But scabies has a pretty unique presentation. Bed bugs, something else that I'm an expert in, and I'm sure that I'll do a vlog or even a blog post about bed bugs and how you know if you got bed bugs and what you do if you have bed bugs. But bed bugs don't really bite under clothing, so if you're staying at a hotel, sleep with socks on and long pants and long sleeve shirt, and you won't get bites under your pant leg or under your sleeve. Bed bugs don't really itch that bad either. They just leave a little blood spot when you wake up in the morning, and then over the next day or two they might start itching, and especially if you get an infection from scratching with dirty fingernails, then it'll itch a little bit more, but it won't really keep you awake at night like scabies does. Scabies has been around for thousands of years. When dogs or coyotes get scabies, it's called the mange. All their hair falls out from biting and scratching. And now, humans can't really get scabies from canines, although you can get it for a day or two, but the bug can't complete its life cycle, so it'll die off within 2 or 3 days, and it goes away. So that's not a big deal if you get exposed to a stray dog that has the mange. Sarcoptes, the scourge of mankind, kind of like lice, is not necessarily tied to your socioeconomic class or your general level of hygiene or cleanliness. You can get it anywhere, anytime. So scabies, you know, it's really not something to be embarrassed about. And also, as far as bugs go, scabies don't really carry diseases. You can't get malaria from scabies. And you can't get Lyme disease from scabies. So, you know, it makes you itch, makes you feel dirty, but it's just a little bug. Be nice to it. Or kill it with permethrin cream or ivermectin. Tablets are probably the best way to treat it. In the old days we used well, I don't say we because I'm not that old, but they used sulfur-based ointment, like sulfur in petroleum jelly, and they smeared it all over. And that's actually still safe for babies and for pregnant women or women who are breastfeeding. What else do I have to say about scabies? I'm not sure. I'll write a little blog post about it. And if you have further questions, put it in the comments to this video, or put it in the comments on the blog, or send me an email off of the blog. Please don't post photos. I mean, I get those photos randomly texted to me when I'm sitting there in church, and all of a sudden I get a text and I'm like, there's some nasty rash staring at me in the face. Actually, I don't mind, but I can't really tell much based on a iPhone photo of your rash. So anyway, I mentioned I was itching just talking about scabies. If you think that you were exposed to scabies, then you probably have scabies. It's real common that a parent will come in and their child was diagnosed with scabies and they want to get treated also. It's a good idea to treat everybody in the family, even neighbors who might, or kids in daycare who come and hang out together in the same area. They probably need to be treated. You should wash your bedding, you should wash your clothing. Hot water and hot setting on the dryer will generally get rid of the bugs. You might tie it up in a bag for 72 hours and generally the scabies will die off. That actually works for bed bugs also, but you have to leave them in the bag for much, much longer and make sure that it's airtight and they don't have a source of food, which is a human. Close contacts, sexual contacts need to be treated. I'm itchy now. I don't know about you. You actually don't really get them in your head, so if your head's itching, it might be lice, but okay. But I know a lot about scabies. Well, probably because I see it several times a week. Still makes you itch every time you see it, even if you don't get it. I wash my hands a lot. And I generally won't shake your hand if you're coming in with an itchy rash. If I don't shake your hand, it's because you have an itchy rash. I don't think you're disgusting. I'm just not touching you. Hi, my name is Mark Harvey. I'm a family nurse practitioner. Mark Harvey, family nurse practitioner. Visit my blog, diabeticdogmalysis.wordpress.com.